few of you have asked me if you can refuse cervical checks, so let's talk about it. The answer is yes. Cervical exams are completely optional, even during labor, unless it's an emergency. It's your body. You can refuse and or delay cervical checks. Don't feel pressured. If you're anxious about cervical checks, totally normal. They feel different for everyone, but nobody loves them. If you are really struggling with cervical checks, like they're super painful, super uncomfortable, ask your nurse if they have oil, like mineral oil. A lot of times we use KY or some type of lubricant to check your cervix. I found that patients who really struggle with exams a lot of times do better with oil. So not every hospital uses it, but ask your nurse if they can check you with oil instead of lubricant. Let's talk about when you might actually want to have your cervix checked. First is if you are on Pitocin. You might want to have your cervix checked to see how your labor is progressing on Pitocin or if you need more medication. Next, if you're on the fence about pain management, you might want to get your cervix checked before your window for an epidural closes. If you come to the hospital because you think you might be in labor, you might want to get your cervix checked so that we can determine if you are actually in labor. A lot of the times, this is how the doctor determines if you are going to be admitted. So how often should you get a cervical check? Your provider might offer to check your cervix in the office once you're 36 weeks. This is optional. If you'd like to have it done, that's your choice, but completely optional. Once you are in active labor, it's typical to have your cervix checked every 2 to 4 hours. Of course, you can request to refuse these or delay these if you would like, but 2 to 4 hours once you're in labor is normal. If you're on Pitocin, it's probably closer to every 2 hours to determine if you need more medication or not. Here's why we shouldn't check your cervix too often. With every cervical exam, your risk for infection increases, especially if your water's broken. Cervical checks don't speed up labor any, and honestly can be pretty discouraging if you're not progressing as fast as you expect it to be progressing. So bottom line, yes, you can refuse cervical checks. You are in control of your body. Save this video so you have it when you need it and give me a follow.